Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. First of all, let me thank you all for coming here today. To be honest, I'm a little bit nervous, but the show must go on. Let me introduce myself. My name is Naura Filza. I'm a first grader medical student from Faculty of Medicine in Unisula. It's nice to meet all of you guys. Okay, as you can see on the screen, our topic today is what is Reiki, stress reduction and relaxation. By the end of this talk, you will be familiar with Reiki. My presentation will take about 7 minutes. If you have any question, I'll be glad to answer all of your questions after my presentation. In my presentation, I've divided my presentation into 5 main parts. I'll start off by explaining the definition, then I'll go on to the benefit, next the treatment process, after that the testimonials, and the last is conclusion. I'm going to give you the definition of Reiki. Put simply, Reiki is a stress reduction and relaxation technique that promotes well-being and pain relief through energetic transfers. Meaning, as a healer, Brin, a Reiki master in San Francisco, sends energy, also known as Ki, to a client by placing her hands on or above their body. Over the course of a session, this energetic transfer works to remove blockage in the recipient's body and promotes the flow and balance of Ki. When our energy is out of balance, we may feel this imbalance emotionally in the form of anxiety, stress, or depression, explains Jennifer Brin. That's all I have to say about the definition of Reiki. Now let's move on to the benefit for ourselves. I'm going to show you the benefit of Reiki. Treating energy with energy is exactly what Reiki aims to do. Brin believes anyone can benefit from Reiki. Her clients include cancer patients looking to ease symptoms, executives trying to reduce stress, busy mothers seeking balance, teenagers suffering from anxiety, and even athletes hoping to heal physical injuries. Reiki stimulates the parasympathetic nervous system and transports us to rest and relax mode, allowing time for our mind and body to reset and heal. Data from the hospital's pilot program reveals that Reiki, along with other integrative solutions like meditation and yoga, can decrease blood pressures, heart rate, anxiety, and pain among radiation oncology patients. That's all I have to say about the benefit of Reiki. Now let's move on to the treatment process. Let's begin by the process of Reiki that I want you to know based on the article I have read. Brin sessions begin by discussing a client's emotionally and physical issues. He then gives them a chance to settle on his healing table. Clients remain fully clothed with shoes removed. He scans their body to tune into any energetic blocks, then guide them through a very brief meditation to help them relax. Brin began the Reiki healing with his hands at the crown of the head, working down through the energy centers, also known as the chakras, and finally and at the feet. During this process, Brin notes that most clients fall into deep relaxation. Some even fall asleep. At the end of the healing, he gives them time to acclimate and discuss what they felt. Everyone leaves feeling renewed and restored to a balanced state that many have never felt before. That's all I have to say about the treatment process of Reiki. Now let's move on to the testimonials. There are so many positive testimonials. A memorable client of Prince once came in complaining of headaches she had been suffering from since falling and experiencing a concussion. After Reiki, client said her headache was gone. Client even emailed Brin 3 days later to tell Brin the headaches they had been experiencing for 3 months straight had vanished. The International Center for Reiki Training's website has dozens of similar positive testimonials. Alright, we have looked at the 5 main topics of our discussion today. Finally, I summarize my presentation. In conclusion, while these anecdotal stories and phrases like energy healing may garner a few eye rolls, it's worth keeping an open mind. Preliminary clinical research shows that Reiki may be useful for anxiety and pain management. Medical institutions like New York Presbyterian Hospital even offer Reiki as a complementary treatment to patients. Whether you are already a Reiki devotee, curious to try it, or more doubtful, Brin believes that Reiki's efficacy is not dependent on your belief in it. But when the clients leave Brin's office, they have an easy smile of someone deeply relaxed. Reiki speaks for itself. That's all. Are there any questions or something we can discuss it together? Or you can ask some question in the comment down below. I think it's enough. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.